Good morning, everybody. Well, in the big family of last generation drug-eluting stent, the abluminous technology is very interesting. And my feedback, started a few months ago. And I have to say that initially I was doubtful about the fact that this new technology was actually full of new expectations. In particular because, as you probably know, this is a device actually composed by three different parts. The main and most important is, of course, the stent, but the interesting thing in my mind is the fact that the balloon in which the stent is crimped is actually covered by the drug. So, during the deployment, this device can actually give a burst of drug to the artery and then to leave the stent in place, which will elute the drug afterwards, and probably in actually 1 month. So I have to say that this new technology in my mind was suspicious, more or less, because I thought to myself, would it be trackable? Would it be pushable? Well, in particular compared to other drug-eluting stents. And I can tell you that my feedback now is absolutely positive, because I challenged the device in very complex lesions, and I can tell that the acute result, at least the acute result, is very, very, very encouraging. I'm not sure about the long-term result, but we are here to study. Well, according to the physiology or physiopathology of the atherosclerosis in diabetic patient, which is more aggressive as compared to non-diabetic patient, and it is because the diabetic cell must have a very high dose of antimitotic drug to stop the growth, I would say that the possibility to give a burst of drug immediately after the deployment and then to keep up the elution in 1 month time would be logically good for stopping the process of in-stent restenosis leading to clinical restenosis in diabetic patients. So the answer is yes. I do believe that it is logical to understand what is going on in this specific subset of patients, which is still high risk, which is still one of the settings in which interventional cardiology has some kind of suboptimal results. The dedicated registry is the natural evolution of what we thought was logical for diabetic patients. I mean, this dedicated trial is going to be a prospective registry on a nationwide size. We are planning to include at least 15 Italian centers, enrolling around 1,000 patients, diabetic patients, for any indication to PCI, regardless the fact that they are insulin dependent or non-insulin dependent. Acute coronary syndromes as well as inducible ischemia will be enrolled. And definitely our goal, our expectation is to find that this device will be able to provide better protection for these patients, in particular because we are pretty sure about the acute result of the device, but our goal is to provide a long-lasting benefit, reducing the risk of new events, which is actually the Achilles heel of diabetic patients nowadays.